Her diagnosis was trisomy 21, and I found out when I was 17 weeks pregnant. I found out about 20 weeks pregnant that she had a hole in her heart. Right away, they said that she would have surgery.
So Genesis was born with something that we call an AV canal defect, which is very common in babies with Down syndrome, and it essentially means that the pieces of the heart that are supposed to grow together to separate the right side and the left side don't fully form, and that leaves a communication between the bottom two pumping chambers and the top two collecting chambers.
So I did some research on Google looking at the best surgeons, the best heart programs. Being closer to this hospital just made it much easier.
Fairly recently, we've set up a collaboration with between UVA and NVCU, and the whole purpose of this is we want to combine expertise, resources, so that we can be one strong collaboration, one strong team. And our whole goal is that we just don't want patients to leave the area to have congenital heart surgery. Our results are as good as anywhere in the countries, and we would prefer to keep these patients, at home. And, in Genesis' particular, in her family situation, they have other siblings, and, it would be very difficult for the mom to travel elsewhere.
The goal of that collaboration is to really kind of standardize congenital heart care across the state of Virginia, so that a family that gets care in Richmond or in Charlottesville or kind of down closer to the beach, the care that they're receiving at any of those locations is the same in any location. So we've got great quality care, kind of standardized care happening across the board.
So for a repair of a complete atrioventricular canal defect, what we do is it is open heart surgery on babies that are, this size and this age, which is intimidating to think about. But what I always tell parents is the babies tolerate the surgery better than the adults do. We actually have to close the hole in between the atrium, the hole in between the two ventricles, and then we have to reconstruct that one valve that separates the atrium and ventricle into two separate valves, what becomes the mitral valve and what becomes the tricuspid valve.
So babies do great. She was in the hospital for a couple weeks with some kind of expected complications, draining fluid, getting her back eating and that sort of thing. By the time she was ready to go home, things are pretty straightforward from that point in time.
She made me feel comfortable. She knew what she was talking about. She answered all my questions. She just kind of walked me through it, and it just kind of eased my mind. So she's rolling over, she's kicking, she's not as pale, she's babbling. Before heart surgery, she just kind of slept the entire time. Just slept hours and hours and hours, and she struggled to eat, but now she's finishing her bottles. I can sleep so much better knowing that her heart is repaired.